The carpal tunnel syndrome is a localized entrapment neuropathy of the median nerve within the carpal tunnel. And based on the traditional practice models, the carpal tunnel syndrome is a localized pathology at the wrist because of the localized compression of the median nerve within the carpal tunnel at the wrist. The patients of carpal tunnel syndrome typically present with wrist and hand paresthesias and pain, typically worsening at night. It may also include neurological symptoms and functional limitations. With the symptoms typically limited to the wrist or distal to the compression at the wrist, physiotherapy mainly uses localized therapy approaches targeting the wrist and hand in the management of carpal tunnel syndrome. For conservative management, the local methods used in physiotherapy are splinting, laser, use of exercises, and tendon gliding maneuvers. As we discussed, the signs and symptoms of carpal tunnel syndrome basically lie within the median nerve distribution, but it is not uncommon to see extra-median spread of symptoms that may involve the whole hand, the proximal segments of the arm, or sometimes even bilateral symptoms. What we see now is a generalized disturbance of the sensory motor function, also known as the sensitization of the nervous system, and in carpal tunnel syndrome it happens both peripherally and centrally. Typically, sensitization will include increased responsiveness to stimuli, reduced threshold, increased spontaneous activity, increased receptive field size. All these lead to increased input to the CNS. And once these are established, normal nociception is required to maintain this process, and even non-nociceptive inputs can lead to the maintenance of inputs to the CNS. So, the current literature describes carpal tunnel syndrome as not just a simple compression of the median nerve locally within the carpal tunnel, but as a complex disorder exhibiting sensitization mechanisms.